Hi, Courtney. Welcome to the Arrivals podcast.
Hi, Merelise. I'm so happy to be here.
I'm so happy you're here with me today. Thank you so much for coming on today. I wanted to talk to you specifically. I feel like you are a really good person for me to have on this podcast because I would say we have pretty different approaches in a lot of ways, not in every way, but in a lot of ways to birth. And so I always just appreciate like hearing your perspective. I like hearing someone's perspective who's different from mine. I always learn. And I think it's just good for other people to hear as well. So I'm so excited to hear you tell your birth story about your beautiful baby girl. And we'll have you on in a couple months to tell your second one. Courtney's currently pregnant.
That's true. This is story number one. Story number two is TBD.
TBD. So where do you want to start? Do you want to start with 40 weeks or wherever you want?
Yeah. So I will also echo, yes, I enjoy that we both approach like birth differently, but we both like really love it.
Yes.
And like love talking about it. And I feel like I like have to like give a disclaimer. Like
Please.
My perspective on it is colored by my job, so because I do medical malpractice defense work as a lawyer, unfortunately, if something ends up in my office, it's because someone's birth story and delivery didn't go exactly as planned. And so it's made me just a very discerning, I don't know, patient. But so like I have that perspective in my mind, just kind of like floating around at all times. Like I've worked on plenty of birth, labor, and delivery cases like before I was ever pregnant or had a baby.
Yeah.
And so that's just like, it's always like kind of in the back of my mind.
Right.
That essentially like I've seen all like the really bad stuff.
I know. It's true. Like I do feel like you, to your earlier point, you really get all the negative stuff.
Right. My perspective is like somewhat colored by that. But with all of that said, my other disclaimer is like I ended up having overall like a positive experience. I walked out of the hospital like pleased with my experience overall. And that was with some like bumps in the road to getting out of the hospital.
That context and that background was helpful. And then why don't you maybe tell us about what your kind of plan or preferences were leading up to birth? Like where were you physically? Where were you mentally? What were the doctors saying? How were you feeling?
Yeah. So my plan from like the outset was to always have an epidural. I was open to induction if I needed one. I was like never set on avoiding an induction. I was going to be fine with one if it got recommended. That's kind of how I approached that part, which I say because I'm jumping ahead. I do get induced. But so the real kind of like hang up or issue pre-actual labor, which you're well aware of because I called you in a panic, was I had a low platelet count in the final weeks of pregnancy. So probably starting like week 36 or 37, my platelets were low when they did just like routine blood work at an OB appointment.
And up until then, you'd had a very standard pregnancy.
Correct. Like no issues whatsoever, essentially. And so because my platelets were so low, there was a question about whether or not I would be able to get an epidural because the anesthesiologists don't want to do an epidural on someone who isn't clotting correctly because obviously they're sticking a needle into your epidural space, like the space around your spine. And they want you to be able to like clot appropriately if something were to go wrong. So because of that, they were like testing my platelets all the time. And they were like very much like borderline. Like my OB was like, they really may not, depending on what anesthesiologist you get, like you may.
And their comfort level.
Right. You may be, they just simply will not allow you to get an epidural, even if you really wanted one.
And do they have any idea of what causes low platelets? Is there a way to manage it?
So the answer that I was given and that, you know, of course, like I'm a human, I Googled, is that it's just pregnancy induced. Like probably, I think maybe 5 to 10% of pregnant women statistically get low platelets. Now there's a range of that. Like you could have the diagnosis of like, it's thrombocytopenia. I did not say that correctly, but like you could get that diagnosis and and it still not be so low that you can't get an epidural.
Right.
But so lots of women have it, but it doesn't end up impacting their ability to get an epidural. I would have been in the like minority of the people if it had been so low for
Yeah.
that. But it's just pregnancy induced. They like essentially they do a bunch of extra blood work for you after pregnancy to confirm that like everything went back to normal.
Yeah.
And for me, like everything
went back to normal.
So
interesting. And there's no way to manage it. Like, it's not like you can't get a transfusion. You can't take any medicine. Like, there's no way to change it. It just kind of is what it is.
I think in some scenarios, if it got low enough, they would try to give you a steroid injection and have the steroids like trigger your body into like this rush of creating platelets. Yeah. But mine was never so low that they were like concerned about anything other than the ability to get an epidural, which is not, that's just for everyone's comfort. Like,
right. It's not a true medical emergency.
Epidural.
Yes.
So they can give you steroids in certain scenarios, but that wasn't my scenario.
Yeah.
So it was essentially like, sorry, you're out of luck.
Yeah.
Hence me calling you in a panic. Like, crap, I've been planning on getting an epidural. What do I do?
Crash course.
Correct. So that was like the one going into labor kind of hiccup.
Yeah. How did you feel about the potential of not being able to get epidural? I mean, I feel like we talked about it initially. I sent you my like kind of standard recommended reading and resources, et cetera. And then I know it was kind of up and down. So I feel like in my mind, you were kind of like, I'm just going to go with that. I'm going to be able to get one when I get there. But how were you feeling about it leading up to it?
I was mainly what you just said and just trying to remain positive and like, it'll be fine. Like, they won't really not give me an epidural. But also was like, but that is also to tone down on my like internal true anxiety. Yeah. Like, I really had very little desire to attempt to do it without an epidural. Like, more power to ya if that's like the route you want to go. And all I kept saying to myself is like, okay, well, if I have to do it, which funnily enough is what the nurses told me when I got to the hospital, and it was still this question mark of like, will they, won't they, was like, lots of people do this without an epidural and you can too, which is about like all the positivity I could come up with, which was that like, it has been done before for millennia, in fact. Yes, and
it is possible.
It is clearly possible.
Not desirable.
Yeah. So,
because the only other option is a C-section, but they have to put you under it completely, right? Like, you can't be conscious during it.
Correct. Which was the reason why I was like, well, I'm just going to have to like buck up, woman up, and deal with it, because the alternative of not getting it, like, it was either labor with no epidural or then if you can't get an epidural, most people when they have a C-section, it's via epidural. So if you can't get one of those, they just have to put you to sleep.
Yeah.
And the idea of like not being awake for especially your first child's delivery, I was like, that's calling it a bummer is such an understatement, you know?
Yes.
Like, I was like, that
so
was just
far from
weird.
Preferred.
And it made me think of like my grandmother telling a story about having one of her 3 children where they were still using like Twilight gas, whatever they even used for it, where they just kind of like put you like half asleep and half under. And then you just like woke up and you'd had a baby, but you like had
feels very Twilight Zone.
Right. And it's just very, I hate the idea that it like takes the patient out of the equation when it's supposed to be like a collaborative decision-making process. And I'm a control freak, so that none of that is appealing to me. And it's just like a cool experience.
Of course.
That, you know, you want
to remember,
literally conscious for. So that was my other concern. Is like, well, I'm just going to have to suck it up and deal. Yeah. Because I certainly will fight tooth and nail to not have to go under general anesthesia. So, and then the long story short is that I ended up being able to get an epidural.
Yes. All that to say.
Praise me. Dr. Cersei is my favorite human ever.
Shout out Dr. Cersei.
Like, anesthesiologist who, you know, was fine with my pretty low platelet count. Yeah. Then let's see. So that was what was going on in the background was like, my platelets are low, and they kept being low every time they tested them. Like, you know, they were testing them probably twice weekly, like from 37 weeks, 38 weeks. Then 39 weeks comes and I'm at my regular OB appointment for the week, and there's protein in my urine, which can be a sign of preeclampsia. And my blood pressure was fine, which that's like the main concern with preeclampsia, or that's always been my understanding. So my blood pressure was fine, but because I had protein in my urine.
And your ankles were very swollen.
I was very, very swollen, which like is a can't be sign of preeclampsia, but given the protein in my urine, plus, yes, I was so swollen from the knee down. Lord, it's already starting this pregnancy, as I have already complained. Like, thank God I've gone through it once, and now I know that like it will, this too shall pass.
Yes,
but
they'll go back to normal.
Comical how large they get. So yeah, so I had protein in my urine. I'm 39 weeks, which means I'm term.
Right.
And they're erring on the side of caution. And again, I'm not like wanting to avoid an induction. Like I'm comfortable with an induction. And at that point, I was already 2 centimeters dilated and probably 50 to 75% effaced. I was told both, depending on who had done the exam, like at the OB versus at admission.
Right.
So like I felt that was another reason that when they were like, all right, you got protein in your urine, we'll probably recommend that you come in. And I was like, that's fine. Like I'm comfortable coming in, like, and getting this party started.
You weren't like starting from zero.
Right. I was like, okay, I feel this will be fine. And it is their recommendation. And I don't want to get full blown preeclampsia. So
no one wants that.
Right. So here we go. And the best part is that phone call about, yeah, we like tested it a second time. There's definitely still protein in your urine. I was at a hair appointment, like getting my highlights done and getting a haircut.
Very important.
And so literally I'm on the phone being like, so I have like foils in my hair. Can I wait? Like, do we have like another, like,
how emergent is this?
Right. I was like, can you give me like 2.5, 3 hours to finish this, get home, grab my bag, grab my husband and get to the hospital? And she was, of course, laughed at me. I was like, yeah, that's totally fine. Like, I'll, tell the hospital you'll be there, by dinner time.
Any blondes out there will understand. That was a very fair question that she asked.
And then I ended up like with a blowout for
yeah, your hair looked great.
Right. Like in every picture, like right after the baby was born, like my hair still looked great because I'd gotten it blown out professionally, less than
brilliant.
Like 24 hours earlier.
It's actually perfect timing when you look.
So that worked out fantastically. So yes, so I finished my hair appointment, called David. We meet at the house, grab the bag, head to the hospital. Get to the hospital. They're obviously like expecting me. So they have us, they triage me, they like check me on the monitor briefly. And then they're like, okay, wait here. Like we're getting your room ready. So we hang out in the waiting room for a while, which was normally you're probably like, why on earth would you tell us about waiting in the waiting room? That's not exciting. While we were in the waiting room, like, we're first time parents. Like we're like very like jittery. And it felt, like first day of school,
Christmas Eve. Yeah.
Like it reminded me a lot of that feeling like when you're about to go on a big like international trip that you've been waiting for forever. And you're just so excited, but you're also a little nervous because it's a new place you've never been.
Yeah. But and all you have to do is board the plane and then you'll be off. But like leading up to getting on the plane, it's like, oh.
Right. Like you're like, have I packed everything? Like, do we have what we need?
Do we have our itinerary?
Yes. So while we're sitting in the waiting room, just like chitter chattering, this triage nurse who'd like triaged me like rushes past and she's holding like a little newborn baby.
Oh my gosh.
And then they wheel in a mom like from the just like the roundabout drop off area.
Oh my God.
And then dad comes in shortly thereafter. He'd clearly gone to park the car. And from like listening to the nurses talk, it was this mom who it was her 5th baby.
Oh, goodness.
And that baby had just come so quickly. Baby had been born like at home.
Oh my goodness.
And so dad like then drove baby and mom to the hospital so they could like obviously like get checked out and all that. David and I were just like, oh, okay.
It's quite the opposite experience from what you guys, wow, that's wild. It's not even in the car, just at home.
Right. And then you go and the nurses was like, well, that baby was just like probably walked down.
Yeah, I know. Just didn't even have to push.
So that, made the waiting room exciting. But anyway, so then eventually we get taken back to labor and delivery room. And it's, I guess, like right around shift change. So I think we met the like initial nurses, but I literally remember nothing about them because literally as they came in, they were like, we're going to do some paperwork, but like, you're not going to see us. Like,
so this is evening, like around 7:00-ish.
Correct.
Okay.
Yes. Like your new nurses are going to be who's like really doing this
going
overnight.
on this trip with you.
Correct. Which I was like, okay, makes total sense. And I met with my midwife. So I bet actually the same OB practice you are, which we didn't realize
until maybe after we had our first babies.
It's been quite some time.
Yeah.
But so there's obviously like a lot of midwives there plus OBs. And so it was a midwife who was like admitting me, and I got up until the very end. My whole labor was managed by midwives, which I was pleased with.
Did you make that choice, or is that just how the scheduling worked out?
I think because looking back on it, I think because I had, during some of my prenatal visits, I had just for scheduling purposes scheduled with a midwife because that's who was available like the time I could go. That then like in my chart, I was in the list of people who like was good with a midwife managing me, which I am. So it was like a choice, but a like very inadvertent one.
Passive choice,
yeah, very pleased with it. I mean, especially at a hospital the size like where we deliver, and our practice group is so big, there's always an OB there like in the hospital. So it's not like a midwife, if like a true emergency arose, would need a physician to come
perform a C-section.
Yes. Which like if you're out in some like rural place and a midwife is managing you, that could mean like calling the doctor and the doctor's got to get in from 30 minutes away.
Yeah.
That I am like risk averse enough that like would not jive with me. But in like a giant, system hospital, like where we are, there's always an OB around. So then I think midwives are fantastic, and they like honestly probably like deliver even more babies than the OBs.
Probably,
I'd had a good experience with them prenatally. So and I really liked the midwife who happened to be on, but she was great. And so I met with her. We talk about my preeclampsia. We talk about my platelets, and I'm like stressing to her, like they draw my blood.
And you're still not qualified though as preeclamptic, right?
Yeah. I asked her that. I distinctly remember asking her this. I was like, so do I have preeclampsia, or are we just like calling it like, is that what we're like truly calling this, or are we just like erring on the side of caution? And she was like, technically you have it.
Oh, wow.
That's the indication for the induction is preeclampsia. But so they're monitoring.
On your chart, it will say it.
Right. Like if you looked in my chart, it would say I had preeclampsia.
Okay.
That said, they put me on a blood pressure monitor because of that.
Right.
Which they were going to do for anyone who had protein in their urine.
Right.
That's why she was getting induced. But my blood pressure like stayed normal throughout my labor. So my preeclampsia never really like developed.
Manifested.
Yeah. Which is great.
Yes.
So they put me on the monitors. They start my induction with Cytotec, which I actually always forget this because, again, because of work, you can get Cytotec vaginally or orally. And sometimes I'm like, which one did I get? Because I've had cases where it's like, I think I got it orally.
Okay.
But then I also had a Foley bowl put in where they put a a
catheter, basically.
A catheter and like a little balloon up into your vagina. And then they like put it like, I don't actually know if they put it, I guess they kind of put it like above your cervix, in your cervix. But the idea is that they like fill it with water to try to help your cervix start like effacing and dilating.
Yep.
So
and the Cytotec also is supposed to help with effacement, correct?
Yeah. Yes. I guess the Foley bulb is said more for dilation and the Cytotec is more for effacement. So I get a Foley bulb, which lots of people say is they find like quite uncomfortable.
Yeah,
and,
I
like,
was going to ask you.
It was fine.
Okay.
Yeah.
That's good.
Like no major complaints. I mean, it's somebody like sticking something up your vagina. It doesn't feel wonderful, but it wasn't like painful. I don't remember it being particularly painful.
Was it uncomfortable in that it limited your range of movement?
I think it would have been, but like because of the preeclampsia, I had to be on a continuous monitor anyway. And this was like, at this point, by the time they like do the whole, everything in a hospital, just like everything else in life that you want to happen quickly does not.
Right.
By the time they're really doing all of this, we're like approaching bedtime probably.
Yeah.
It's like 10 o'clock.
Yeah.
9, 10 o'clock. Maybe it's not that late. but around then. But the time where like the fact that that I was going to then lay in bed for a while
wasn't a huge issue.
Right. Like if I was at home, I'd be laying in bed too.
Mm-hmm.
So it was fine. I just made sure I like peed beforehand.
Yeah.
So they do that. And then they're kind of like, okay, we're going to let you be for a while. And we're going to come check on you and see what happens.
Mm-hmm.
So again, this is like 9-10 o'clock, I think. That's best I can recall.
Yeah.
And then we just kind of like chill and rest.
Were you able to sleep?
Not really, because my contractions actually started like pretty quickly. So I contract probably starting about like 10:30 or 11.
Oh, wow. That was quick.
I know. And then by 1 a.m., 2 a.m., I'm like contracting. Like it is one of those things where I'm now like, thank God I was able to get an epidural, which is coming. Because, I mean, like, I truly was like, what the F? Like, this is insane.
So it ramped up very quickly. So you went from like, you went from induction to contractions to like painful contractions within a couple hours.
Yes. Within 3 hours for sure.
Your body was ready. That's what they would call a very successful induction.
I think so. Yes. Like, I think like I certainly fall into the category of induction working like kind of in a textbook way, the way it is designed.
Yeah, they didn't even have to give you Pitocin.
No, and I never got Pitocin.
That's great.
Which, yes, is the next step after the
Cytotec.
cervical ripening. They would move you towards Pitocin if you hadn't started having contractions, or if your contractions were not, the intensity was not enough to like move you towards further dilation and cervical change. So at that point, I'm like, so what do those blood results look like? Like, are we going to be able to get this epidural? And fortunately, by like 3 a.m., they had like, I think what they had done is and they had done this previously in testing all my platelets. Your platelets, when you're pregnant, can clump together. So if you just run like kind of a basic lab report on them, you might actually have more platelets concentration wise than the initial report shows, because they're clumping together. So there's, 3 platelets are together and the lab is only going to count that as one because they're all smushed together. Okay. But then if you looked at the sample under a microscope, like manually went in to try to count them essentially, you'd see they were clumping and you'd get a higher platelet count concentration. Okay. Because someone looked at them. So.
But do they always look at them, or do they say?
No. Okay. So like, because I was telling my nurses, I mean, distinctly, like I truly was like, I really, really want an epidural. And this is before I was contracting. Like this was in my like initial.
That's good that you
admission.
Said. I think that's great to set those expectations with your care team up front. Like be very clear.
Yes. Like I was very much like, my goal is an epidural. So whatever steps we can take to get me there. Right. Let's take them. Like, and that includes like, if the anesthesiologist wants to talk to me about my comfort level of like how low, like if we need to have a very specific risk benefit informed consent conversation, let's have it. Cause like I might very well err on the side of I'm comfortable with maybe a bit more risk because I really want that epidural. Yes. Which that's for every person
to make individually.
Decision. Yeah. So because of that, and because they had previously done, it's called a manual differential, which is where they look at it under a microscope. I think I asked them about that and was like, can you like look, like they did one of these before, if that's a possibility. And I don't actually know if they had to do that to find enough platelets for me to get an epidural. Yeah. But it's more of a, if you too find yourself in this scenario,
ask for that.
Ask for a manual differential because it might
make a difference
and up the number of platelets they find. Or
that's
if
really
you just
good to know.
Want to avoid a C-section under general anesthesia.
Yeah.
So by about 3 a.m., they have found enough platelets.
That's great.
And an anesthesiologist willing to play ball.
And you're in a scale of 1 to 10. What kind of pain are you in at this point? And how close are your contractions together?
I like never know what to do with the pain scale.
I know. That's a hard question.
I'll put it like this. I know I was contracting once every 2 to 3 minutes. Okay. And they were lasting about a minute.
Wow. Yeah.
And I was mooing. Like, I don't know why. Like,
no, that's so many people.
Like, it's like the defining memory of these few hours is like, oh, apparently when I'm contracting, I moo.
You'd be shocked at how many people say that. It's for some reason, it's like, I mean, birth is so animalistic, and then we literally become cows with nursing and pumping. So mooing makes perfect sense if you ask me.
It does.
It's totally natural.
Well, I'm glad it's not just me because I was like, is this like what? Who knew that this was my audible reaction to pain?
In the birth world, they call it vocalizing. You were vocalizing through your pain.
I was indeed vocalizing.
And had they checked you? Do you know how dilated you were at that point?
I actually don't. I was thinking about that earlier in preparation for today.
Yeah.
And I don't actually know how dilated I was when I got my epidural or if they even checked. My guess is honestly they may have done a vaginal exam on me and I just like
we're a little out of it.
Yeah, it was like, I don't care. So I get the epidural around like 3 or 3:30. And
was it hard for you to hold still at that point to get the epidural?
It was really uncomfortable, but I think because I was in so much pain because of the contractions, like I don't remember any additional pain because of the epidural.
Right.
Which I think I would imagine if you're getting an epidural like real early on, they numb you with lidocaine like in your back before they give you the epidural because it hurts. They're sticking a big needle through a number of anatomical structures. Yeah. But I honestly like don't remember that part at all. I remember like sitting there like having a contraction while the anesthesiologist was doing her thing. Yeah. And being like, keep going. Yeah. So I get the epidural and
it's a relief immediate.
Yeah. That's just awesome. About quite quick, if not immediate. And then I was able to rest, which was nice. Oh, the only other thing I'd forgotten that they had given me fentanyl before the epidural when we were still figuring out if I could get one. Yeah. As a form of pain management. And like, I don't think that did diddly squat.
I had fentanyl with my second and it same. Maybe got me through one contraction.
Yeah. It just seemed extremely short-lived. And I guess I felt a little like high, like loopy. Like, like I had been given an opioid medication. I've never taken them before, but thank God.
One could imagine. Yeah.
Yeah. Like I was like, I imagine it feels like what you want. I mean, that they're doing what they're supposed to do, but it just didn't last very long. They come in and wake us up sometime in the 6 o'clock hour because like shift change is coming up at 7. And I guess pretty early, maybe around 6, and I'm complete. Okay. So I from getting to the hospital till being complete and ready to start thinking about pushing was
like 12 hours or
12
less.
hours. And that included like 2 hours in the waiting room, you know? And from like the actual start of induction from like Cytotec and the Foley bulb on was like, 7 hours. Right. 8 hours. So like all in all, like quite fast. Yeah. So I'm complete. They have me do some practice pushing.
That always makes me laugh, the practice pushing. And I've heard so many people say their practice push ended up being the real thing.
Yeah. So they want you to. From like having talked with labor and delivery nurses and OBs, mainly the nurses, because it's usually the nurses that are in there doing that. OBs don't show up till like maybe
game time,
like truly about to be born.
Yeah.
A lot of it, I think, is so that they too can get a sense of like, you're complete. Like you, like your 10 centimeters dilated and your cervix is 100% effaced, but like it also has to do with station of the baby. Yeah. And I think those practice pushes can also help them see like, okay, like how high up is that baby's head from where it really needs to be able to be born.
And a lot of times, like in hindsight, I think with my first birth, I was complete, but I think I should have done what people call like laboring down, is where you're 10 centimeters, but you continue to labor because you're not necessarily quite ready to push yet. Like this baby might not be fully engaged in the pelvis. And so, yes. So,
yeah, which is, so we did practice pushing, and then I pushed for probably 20, 30 minutes. And then my midwife was like, let's labor down.
Yeah.
Speaking of.
That's great that she recommended that.
Yes. And I think I didn't ask, but I think it also must have meant like baby looked good. Everything looked fine. Like, I think it was like, we can take a break. And I also think it was a way of them being like, these pushers we're not getting very far.
Right.
So
and there's no point if you're not in
Correct.
pain and baby's not in distress.
Correct.
There's no point in pushing if your body isn't ready, if you're not making progress.
Agreed. I very agree. Could not agree with all of that more. That like, yes, when you're complete, that means like you could push, but there's no reason to exhaust yourself.
Yeah.
If delivery needs to happen
Right.
and they think pushing's the fastest way there, then they'll tell you to push.
Right.
But if they're also like, we could chill for 30 minutes, then by all means do.
Yeah.
So they had me, I was essentially sitting like Indian style, and my epidural was like doing great with pain management, but I could still feel a lot of pressure. Like I could feel a contraction build.
Okay.
But wasn't in pain, which I honestly
that's ideal.
Like what an epidural ideally should be, or at least in some people's is just like, I don't care, I just want the pain to go away. But some people's epidurals, they only take on one side. Yes. There's like one like hot spot or whatever.
Or they wear off. Yeah.
Yeah, exactly. I think luckily mine, because I got it, I'm like pushing when the epidural hasn't been on honestly that long, that like mine never had time to run out.
Yeah.
Which is nice.
Yeah.
So I labor down for like 30, 45 minutes.
And are you just sitting there like talking to David? Like, yeah.
And I'm in, so they like pushed me like my bed, like all the way up. So imagine I'm now like sitting almost straight up, like I'm in a chair with my legs. Like they had to help me do
I was going to say, could you move them?
Put them into like Indian style, like kind of like sitting in like, they truly described it. It was like, think of like those, like the Hindu, like goddess picture of like a pregnant woman sitting like belly out, boobs out, legs crossed. They're like, that's the position we're trying to get you in.
Fertility goddess up in here. I love it. So it's probably helping to open the cervix and just.
Yeah. And just, and they put you all the way up, like truly, like, they're like, gravity. We're going to see if gravity will do its thing, and just like, boop, boop, boop.
It's interesting. I know gravity is such a huge thing in labor, and a lot of times they talk about the benefits of not having an epidural is that you can walk around and gravity helps. But I've never heard a birth team do what they did for you, which is just sit you straight up, so that because you couldn't walk, at least then your gravity is still somewhat helping in that position. That's smart. It sounds like you had a really good birth team, honestly.
Yeah, she was great. I plan on this go around, like this time I will very actively say like, give me the midwives. I end up needing a physician to come in at the end of this story, and one appeared, so like I got the benefits of both when I needed both. And it was a good mix. Yeah. And so I labor down. I also, part of me, the slightly cynical part of my brain, does think like it was also a convenient time to labor down because it's shift change. So let my midwife, and she was very honest about it. She was like, I'm going to have to go. And she even came in like a little after 7 and like introduced new midwife to me. Cause like she'd been with me like all night. And so she handled it like the handoff really well. And I really enjoyed that she involved like me in the hand. Like they obviously had a conversation about what had been going on with me outside of my presence, I am sure. But that they also like both came in together to like do the handoff was another like nice, just like patient involvement.
Yes. Bedside manner.
Yeah.
A+.
That they handled well. So after I labor down and I now have my new midwife, we start pushing again. Though funnily enough, new midwife who was much more like drill sergeant-y about my pushing. Like she was like, I need more. Like, okay. Like she was like, let's go. Like that last go round was like
ain't
not
gonna
the real deal. Like I'm going to need to see more out of you.
You're like, yes, ma'am.
Got it. So then we did still have to push for another 45 minutes at least. Yeah, I'd say 45 minutes. I think that's right.
Are you able to connect? What do you feel when you're pushing? Like, are they telling you when to push? Are you feeling when to push?
I could feel it. Like I could feel a contraction rising and could feel the urge to push. Like
that's
to the
great.
Point that they were though very active in helping me and saying like, okay, wait, now go.
Yeah.
But like I could feel enough of the pressure that I was like, okay, do you want me to do it now?
Yeah.
They on the monitor can see the actual peak of the contraction. So between me feeling pressure and them being able to see the monitor, we were able to like time the pushes to the contraction.
That's awesome.
Or this was my understanding of what was going on.
Yeah.
And her head for a while, they were like, you got to keep going. It kind of got not stuck, but it was like, I had to push the reason I had to push that long is like it did. And I've heard this from other like people we know too, that to get like under my pelvic bone, like I'm making like a slip out motion.
Yeah. What position are you in at this point? Have you tilted back a little?
Yes. Now I'm tilted back and I'm laboring in kind of just that like classic on your back.
Yeah.
That, like, I know it's not your favorite and I can understand. I will say, like, as much as was like, I want to epidural, which like epidural essentially honestly almost always means you're going to labor on your back. Like that's the most typical. And I guess some people with an epidural will labor on their side probably. But I do like the more and more, not more and more, but like whenever I like just even read like fiction books where they're talking about labor from wherever hundreds or thousands of years ago or whatever, like women are so often like standing.
Yeah.
And it does make a lot of sense.
Yeah. It makes a lot of sense for gravity.
Or if you just watch like Call the Midwife on BBC, like half the time, like those nurses have those moms in like all which ways.
Or hands and knees. Yes. Or almost anything other than back.
Hands and knees, like during the mooing phase, pre-epidural, even in my pain was like, felt like some primal urge to get on your hands and knees. Like I think I just think like, yes, without an epidural, laying on your back is probably not where you're going to end up.
Yeah.
Like I think that only works, not only works, but like that's a product of pain management, right? Not so much what your body may like naturally like want to do when you're in contracting. But I was on my back. Like David had one leg, nurse Madison had the other leg. So we push and push and push. And then I did start getting like a little fatigued just because I was like, okay, we haven't been doing this in a hot minute. And I finally, like, the midwife was like, okay, I think we're making some progress. And at that point, I did ask them, because I just saw it out of the corner of my eye, asked them to bring a mirror over, because I needed, although I could feel pressure, I was A, curious, and B, like, needed to see. I was like, let me at least see if visualizing this will help me, like, understand the instructions more, or just feel like I'm like making progress. So they brought the mirror over, which is wild.
It is.
Yeah.
For me, I found the mirror not that helpful, but I think it's where I was in my labor. I wasn't seeing progress. Every time I pushed, Kit's head would just retract right back up. And so I actually was getting discouraged by it, but a lot of people love it.
I will say, like, the first few pushes I did with the mirror, same deal. Yeah. Like, it makes me think, like, I mean, it makes sense that, like, as you're pushing, the head goes down, but like some of that progress each time is going to be up a step forward and at least half a step back.
It's true.
But then after a while, then I actually saw like true progress.
Yeah.
And then I honestly, like, the like when her head actually got born, I think at that point I was just distracted by the actual pushing that I don't even have like a particular
visual
memory of seeing that. Yeah. The mirror was there, but whatever.
Yeah.
And out she came. And the first thing I yelled was, she has hair, which I wasn't expecting because I was a pretty bald baby.
Yeah.
And a very fair baby.
Yeah.
And she had not a ton of dark hair, but she did have some dark hair. It was
distinct. Yeah.
Yes. Which was funny to me, which I mean, it shouldn't have been. David has dark hair.
But still, everything about your baby is fascinating.
Yes.
In the beginning.
But it was just funny that, like, that was my first reaction was, she has hair.
Had you seen it when you were pushing them? Had you seen her hair?
Not really. Then it was just kind of, like
gunky. And
I didn't like appreciate it till she was like truly like out and being like hefted towards me.
So you pushed for quite a while, like all things considered.
All things considered, yeah, like probably an hour and a half.
Yeah.
But with like, the first half of that was like, man, I don't really think it did much.
Right, right.
And so then she gets delivered. She's all good.
She's laying on your chest.
Thankfully, yes, we do like golden hour.
Did you do delayed cord cutting or anything?
Yes.
Yeah.
Some of these things I like recently as I'm like getting ready to do this again in, a little under 3 months. I'm like, okay, wait, yes, delayed cord cutting. That is a concept that I was familiar with. And like when I, it's one of those questions they like ask you on admission. Right. And I was like, I know I had an answer ready. And now I'm like, yes, I did do that, right? Like that's the thing I want. And like,
did David cut the cord?
He did.
Yeah.
Yes. And it was so nice. He had one of the nurses just like took his phone away and like took pictures.
Oh, I love it when they do that.
I know. It's like good job for that nurse.
Yeah.
So yes, David cut the cord. And baby was good. David goes over with, we named her Lee. That's her name, by the way. Which the sweet part about her name, I mean, we picked the name out before we got there, but that my nurse for the overnight shift, her name was Lee.
Oh, that is sweet.
Yeah, and before she went off shift, we had not told anybody the name ahead of time, but we told her.
Oh,
like since she wasn't going to get to see the delivery, we were like, wait, you have to know that we're naming the baby Lee.
It's validating. You're like, okay, that's a little sign. We picked the right name.
That's how we felt about it.
So sweet.
So they take baby girl over to do her bath. David goes with her. They did have to call in the doctor for me because I had a bad tear, and that's why they needed the doctor. I guess the midwife was more comfortable with a physician doing the stitching. Which, fair enough. I mean, OBGYNs are surgeons, so I would rather her. I think midwives will do stitching, but probably only if you have like
very
a
like
first
moderate
degree, like mild tear, and mine sadly was not that.
How was delivering the placenta for you?
It was fine.
Not memorable.
Yeah, like I like vaguely, I know it. I remember them saying like, well, it happened, or that like having to do like one more little push or something, but it was a non-issue.
Yeah. So she's been out for like an hour. They're stitching you up.
Yep.
She's getting a bath.
Which now I like the things that like, again, that I'm like, I don't remember. Do they do the bath? Like, do you kind of do golden hour before they do the bath?
It's your preference. It's whatever.
I don't remember. I feel like they might have done her bath. And mine then this is where it also gets murky. Because I think we did like a little bit, and they were going to bring her back after bath for golden hour, which they do. And I'm holding her, and I then have to ask them to take her. I'm like, somebody take the baby. I'm about to pass out.
Yeah.
And I had thrown up already. Like at one point while they had her giving her bath, I felt really nauseous, and I told them that, and they like gave me a bag, and I threw up, which like, I'm kind of like a nauseous-y person in general. And I had just gone through something very strange, and had
sometimes adrenaline can make you throw up. I bet
adrenaline. And I've also, like I have a epidural with like a medication makes me nauseous. I was like, who knows? Like, it didn't seem that weird to me that I threw up. No one seemed that concerned about it. I wasn't either. But then when they bring her back and I'm holding her, I have fainted like once or twice before, and could feel like, I'm losing consciousness here. So I tell them that I'm like, somebody take the baby. I'm about to pass out.
Yeah.
And pretty much ended up, I was hemorrhaging. That is why I was passing out. So I had to get a blood transfusion. We end up spending like kind of we don't end up going to our postpartum room until that around like dinner time. And she's born at 8:35 in the morning.
Wow.
And that's just because the transfusion, like, ended up needing 2 bags. So that took a while. And they just wanted to like monitor me a little bit.
Of course.
Before they like sent me down to the postpartum room.
At what point
we ended up actually spending most of that first day, like in the delivery room.
Wow.
Like my mom came to the hospital that afternoon while I was like still in there, like getting my transfusion, and she was allowed to come. I felt once they like got the bleeding under control and I got the transfusion, like the first bag, it was like when you're really have like low blood sugar and then you eat something. Yeah. That's the best way I can describe it, is I was like, oh, okay, I can feel like again. Alive again. Like I have energy again.
At what point did you come to? Like what was, you said like, that's really scary.
I wasn't like out of it that long, I don't think. Again, like the OB was like, I think she had finished stitching me. So they just like pulled her right back.
Yeah.
And
did David like recall any of it? I can't imagine how traumatizing that is for a partner to witness.
I know. He always describes it as like he was off to the side, like doing something or talking with the baby nurse, and like looked over at me, and truly what he was like taken aback at how pale I was, that he was like, something is not right. Like, and he hadn't noticed as it was happening, but I don't think really anyone had. But yes, he was like, I was very confused. I was really happy. And David is, David, he was like boo-hooing. Like,
I know. Like, kind of he's so sweet.
Yes, he's a big softie. And then he was like, and then I was very confused, and I looked over, I was like, Courtney kind of looks like she's dying.
I'm having mixed feelings right now. This is confusing.
So that was the other thing where, like, again, very happy that like I loved having a midwife, but like very glad that like
you were in a
OBs
hospital
were,
setting.
like, in a hospital with like OBs right there.
Yeah. And was your hemorrhaging at all related to your platelet issue?
I've asked, and no. I mean, I think, postpartum hemorrhage is just
sadly
a thing. Like, lots of women have experienced it, and they've not attributed it to the platelet issue, but who knows?
Yeah.
Part of me is like, maybe, I don't know.
Are you at high risk for having it again once you had it once?
For the low platelets, yes. Like
hemorrhaging
this
them.
Go round, they know to like be extra on the lookout for it. And at least this time I just feel better that like if it happens, it will not be like a total shock.
Right. And it won't be a last minute shock. Yeah.
Correct. Yes. Because once you like have it in one pregnancy, there's like a 50% chance you have it again. But again, you can have it and still, as I got an epidural, like lots of people have low platelets and still it's not so low that you're out of epidural range.
I do have a friend who was so low they were out of epidural range.
I mean, it happens. Yeah. There's a reason that in those initial conversations with my OB, I mean, she was, to her credit, being very open and honest about that fact that it could happen that I would not get an epidural. Yeah. Like she was not trying to sugarcoat it, which is good. Like she was like, if they stay this low, the anesthesiologist who is on call for labor and delivery that night or that day may very well say that you cannot have an epidural. So like you need to be prepared for that. Yeah. Not like it'll be fine. They'll probably do it. This happens. Like she was not downplaying it, which is what I needed her to be doing, like being upfront and honest that like, this is a real thing and you may not be able to get one. So yes, it could happen again. Thus far, my blood work's been fine. I mean, I'm 26 weeks. Okay. But it didn't happen until 37 last time. Yeah. So I'm kind of like, if it's going to happen, it's not going to happen until the end anyway. Yeah. And same with preeclampsia. Yeah. I'm technically at an elevated risk of having it again. Yeah. So they have me on a baby aspirin. Okay. Which is so funny. They're like, take a tiny little baby aspirin. I'm like, we're asking a lot of this thing, but okay. And then you stop baby aspirin right? Because then you don't want your blood to be too thin going into labor, right? You stop at a certain point. I think that they will. I don't know if that's true generally. Okay. I truly don't, but it makes sense. I mean, aspirin is a blood thinner. Like, yeah, it can be a blood thinner. Be used as blood thinner. Yeah. I would imagine if I run into a platelet issue, they may very well have me cut the aspirin just because if I'm already having if they're concerned about a clotting issue, they probably don't want me on an anticoagulant. Right. But again, my platelets have luckily held steady so far. Come on, platelets, hang in there. I'm hoping. For work, I was talking with an anesthesiologist and I was like, how low will you let someone's platelets go? Casual poll. And still give them an epidural, which had nothing to do with the case, but he was just really nice. And we spent a lot of time together that day. So I felt comfortable asking him. And he told me he'd let them go down into, so the way they count these is like, I always forget the actual ratio, but like 100,000 is like the textbook cutoff. Okay. But like, I know I got one and I was somewhere in like the low 90,000s. Okay. And he said he'd even go down to like 80,000. And I was like, I need him to be working that day. It's like, give me an anesthesiologist who thinks like this man. Yes. Can you be on demand? Thank you. Can I get your cell phone number? I know part of me wants to be like, he's in Tennessee. I want to be like, you need to relocate. I was like, I will fly you down to Atlanta. Do you have any like-minded associates in the Atlanta area? Is anybody in Atlanta you can give a call? Yeah. Call to. So again, I'm like, much like last time, and just my personality in general, remaining positive that I will. It's going to be fine. Get an epidural again. But I also think this go around that I had a relatively short labor for a first labor. Yeah. So I'm also remaining positive that if I couldn't get one, it won't be a super long labor. I think that's a fair conclusion. This is my hope. I don't, knock on wood. Most people's second labors are shorter than their first. And my first one was honestly like really quick for a first baby. Short. Yeah. Right. So we shall see. Amazing. So that is the story of Lee. And then after the transfusions, then everything did like calm down and all was was well.
Awesome.
Other than like I had my bad tear, so it hurt like a mofo.
Yeah. Yeah. How was recovery?
Not great. That I like at the time, like I was like, oh, lots of people get a tear, and mine was like they literally a part of me they didn't call it a 4th degree, which is as bad as it can be.
Right. Which is when it
They
all
were
becomes
like,
one.
Yeah. They were like, it was almost a 4th degree. And I was like, okay, I think we should just call that so I get the credit of having survived a 4th degree tear.
I'll give you the credit.
Thank you.
Oh my gosh.
So that was crappy. But, so as I now joke with everyone, like, get a C-section, push the baby out, you walk out stitched up in one way or the other. Just pick where you want them.
Did you stay in the hospital any longer because of your hemorrhaging, or were you just there the standard 2 nights?
I didn't, which was nice. Yeah, so she's born in the morning, and we stayed 2 nights. And then we were home, which was good. Which does go to show, like, despite my platelet issues and my hemorrhaging, especially what I collectively in my head, I'm like, my blood issues.
Blood issues, yes.
They all resolved just fine. And we got to go home with Lee in hand, which was at the end of the day, if you ask me what's my birth plan, I was like, my plan is to go home in a timely fashion and take that baby with me. Like to not have to have anyone stay longer than those 2, maybe 3
to not be separated.
Whatever gets me out of there and that baby not have to go to the NICU. And that's not because like people need the NICU.
Of course.
Kit had to stay in the NICU. Lots of people have really long stays in the NICUs, and NICUs are like,
thank God for them.
Saints who work there. But I
that was kind of your biggest thing.
I was like, I just want to go home with the baby.
Like some people, it's like, I don't want a C-section. Yours was like, I want to go home with my baby.
Yeah, correct. Yeah. I also did not want a C-section.
Yeah.
I don't want one this time. I've never had surgery, and I don't care to start now, And I like really respect when people say it's a major abdominal surgery.
Yeah.
And like, it is.
It is.
And I don't want one.
Yeah. Yeah.
Like, I mean, if you tell me like you have to have one, well, so be it.
Yes.
But it is also like, I would, if I have to be stitched up one way or the other, like I'll take my stitches down in my perineum again.
Did they have any like feedback about why? Is there anything you can like be doing differently? You can do perineal massage.
I know.
Leading up.
Part of me is like, I'm going to have to like suck it up and do it this time.
Yeah. Because I wonder if you have any scar tissue from.
I do.
Yeah.
That was the other thing about recovery is that because the tear, the worst part, well, not the worst part of recovery because it was just painful. I mean, I went home and was still on morphine.
Yeah. Like, no kidding. I mean.
And I told a different midwife who came by.
You had a wound.
And was like, she was going over like discharge meds, and I told her, I was like, I'm still in a lot of pain, and they weren't sending me home on any pain medication initially, and like other than like take Tylenol for your pain, and I was like, can I have something more? Because like this hurts like a lot. I could only sit in certain positions. And like when I got home, there was one armchair.
Yeah.
That like sitting in that chair was comfortable. But then like if I tried to sit on the couch, it was like weeks before I could comfortably sit on the couch. I don't know what it was about the shape of the couch and the shape of my perineum, but
they were not meshing.
They were not. So that was like the other, if anyone wants a pointer, like ask them for more pain meds.
The worst they can do is say no.
Right, exactly. And I think that in most scenarios they're not.
Right.
Though I was shocked that the pain medication of choice was literal. Like it's weird to like get a prescription of just straight morphine.
Was it a pill or was it liquid?
A pill? Yeah. Okay. I know. I was like, okay, this seems intense, but like. I'll take it.
Yeah.
Whatever you're giving out, give it to me. And I didn't even use the full prescription, but it was not, I did use it some the first few days, and it was just nice to know you have
the edge
so
off.
That like, if you are in pain, you have something in your medicine cabinet that you can take rather than I did not want to get home, find that the Tylenol and ibuprofen, cocktail was not cutting it.
No.
And then you have to go through the rigmarole of like,
leaving the house probably to go to a doctor's appointment or going to the hospital. Postpartum,
just like getting on your patient portal and then waiting overnight till the nurse sees it in the morning and can respond and call in the prescription. Yeah. Like the logistics of it is the annoying part.
Postpartum is already hard enough in so many ways, physically, emotionally, mentally. It's just, that's one less thing that one thing you're able to cross off the list of having to like manage and figure out in those, especially in those early days where everything is so hard.
For sure. Like going to the bathroom is literally difficult.
Yeah. Yeah.
And like a production.
Mm-hmm.
Yeah. So we made it home and, are doing it again.
Yes. And our Lee Bug is perfect. She's the best.
I love her dearly.
Well, thank you for coming and telling her story and your story.
Thanks for having me. You know me, love to chat.
I know.
Happy to tell everyone about my, fourth degree perineum tear.
And lots of other stuff. No, I truly feel like your story is like so educational and helpful for people out there. I mean, like I said, I have one other friend who had the condition you had, but other than that, like I've heard so many birth stories and it's only the two of you guys. So who knows, you may be helping someone out there and that's the most important thing.
Yeah. Well, it's a wild ride, no matter what your wild ride is,
Yeah, that's true.
If I've learned anything from watching all of our friends go through pregnancy, labor, and delivery, it's that like, even the ones that at the end of the day, you're like, oh yeah, I had a pretty normal pregnancy and delivery. That's why I love this podcast. Like that can't be true. There is not a single one that doesn't have some interesting nugget of uniqueness.
So true. Speaking of, I do like to close out by asking, how would you describe birth in 3 words?
Empowering, educational, and I'm trying to think of a good word for the concept that is, it's very democratizing is not the right word, but like it makes you feel like let's go with connected. Like I felt very connected to friends who had done this, to my mom, like literally just like I was close to my grandmother who's not even alive anymore, but like thinking about like my grandmother did
solidarity
this.
Maybe.
Yes.
Yeah.
Like it's just, I mean, maybe that's like kind of cheesy, but it does make you like,
I love the cheese.
Have this like empathetic viewpoint with like every other woman who has like pushed a baby out.
Yeah. Or otherwise. And I
shouldn't say pushed a baby out. Who has gotten a baby out of her body.
Yes.
One way or the other. That like, it's such a, it seems like such a basic thing, but it's a wild ride. So
it's magical. I mean, that's part of the reason why I love talking about this. It's cool. It's still how you're still bringing a life into this world. And it's crazy.
Really cool. I get why if you were a doctor or in med school, that it would like hook your attention.
Yeah.
That like being a part of this experience in someone's life would be a really cool thing. Like why people, are labor and delivery nurses and they do it for 30 years. Like, it's really cool.
Yeah. You're witnessing life.
Yeah.
It's really cool. Well, on that note, thank you so much for coming on. You've been listening to the Arrivals podcast. Bye guys.